Welcome to the Scale Up Valley podcast, where we bring the best of the best to help you scale a business from 1 million to 1 trillion. Today's guest is Cristina Rossi, the CEO at b-rayZ. Cristina, welcome to the show.
Thank you very much for the invitation. It's really a great honor to be here and happy to exchange our experience with b-rayZ with the audience. Thank you very much.
It's always a pleasure because it's becoming an habit this year to have women CEOs on the show, which I'm super happy to see that happen, to have a better gender balance. And we also have a lot of cities represented in the show this year, and this time is the time of Zurich. You are from Italy, but
yeah.
Living for a very long time in Zurich, and your company is also based in Zurich. But for the ones who didn't have the chance to get to know you, Cristina, share with us a little bit about your story. I think it's super interesting and super inspiring for others that are coming from your background, that are thinking about starting their own ventures.
Yeah, sure, with pleasure. As you said, I come from Italy. I studied in Italy physics, but I always worked in radiology as a data analyst. And during my academic career, I moved from Italy to Germany, where I did my PhD, and then from Germany to Zurich, where I found a very constructive and productive area of activities at the University Hospital of Zurich. And there I met the other two co-founders of b-rayZ, Dr. Alexander Kiritsis, which is now co-founder and CTO of the company, and Professor Andreas Boss, which is the medical advisor and co-founder of b-rayZ. And they're working in our clinical studies. We thought, okay, we have this great idea. We have the possibility of improving the journey of patients in breast cancer. Now let's take the courage and start this venture and adventure. And so b-rayZ was born really at the University Hospital of Zurich, and we are a spin-off of the University Hospital of Zurich.
Awesome. And tell us more about b-rayZ, how the product works, what is kind of the business model, how is it evolving, where are you? A lot of questions, but just an overview about where you are and what you do at the moment with b-rayZ.
Yeah, sure. A great pleasure. So basically, b-rayZ has the ambition of building a digital platform that supports the journey of breast cancer patients in radiology now, but with the ambition of covering the whole journey, so involving the gynecologist, the oncologist, the pathologist, so that this journey, which is now so much segmented, gets unified and support within this digital platform. Now in radiology, the journey of the breast cancer patient is already extremely complex, because generally when you have a disease, you also have a gold standard in radiology. So you use this technique, which might be MRI or ultrasound or CT, to diagnose the status and then to follow up also the therapies or the response to therapy in patients. In the case of breast cancer, this is much more complex. So you have different modalities, a large spectrum of modalities that needs to be used in the right way according to the specific characteristic of the patients and according to the stage in which the patient is during this journey. This complexity cause the needs or rises the needs of having of eliminating the segmentations and the variability in the decision when it is or which step at which time point is this step necessary for the single patient. And the idea of b-rayZ is really to use AI, to use this extraordinary technology to build a digital workspace around this technology that allows a smooth journey and a standardized journey of the patient in radiology. So at the moment, we started with early detection of breast cancer, and this involves mainly two modalities, which are the mammography or the mammographic modality. There is a certain variability there. And the ultrasound, also the ultrasound, there are different alternatives on the market. What b-rayZ is doing is basically building a platform. At the moment, the target are medical professionals, and support these medical professionals in clinical decisions, but also in automation of tasks which are related to the understanding of the images, but are not of direct diagnostic relevance.
Got it. And in terms of the business model, how does that work? Is the doctors who pay? Do you sell to clinics, hospitals, or what is the go-to-market? Yeah.
Yes, basically the target to the customers are radiological praxis, or they can be a small one, or it can be network of radiological praxis or screening programs. And the software is used in a subscription way, so it's a software as a service. And there are different models in which the software can be priced or can be put on the market according to the profile of the customers. So basically, the best areas, in our opinion, are in our learning where to place the product is, of course, related to the size of the population. This is an important factor to select the area where you want to be, but it's not the only factor. The second factor is related to the maturity of the country to accept a digitalization in healthcare. So there are some countries which are extremely advanced and already have done their homework in preparing the embedding of digital solution into the workflow, and other countries which are too much segmented or not that far, which don't have a source of money allocated for digitalization, that then becomes for us less attractive at the moment.
Right, but do you have any specific ideal customer profile at the moment for the b-rayZ product? So is more a B2C or a B2B motion, the ones who pay for the product? We understood that the ones who use the product are the radiologists.
Yes.
But who pays for the product is also the radiologist or the clinics, or where they are operating themselves?
Yeah. Well, the idea customers are a network of radiological praxis, because the system is a system that allows you to standardize processes which are deployed over a large territory. So our ideal customer are radiological networks or screening programs. And in this case, it's a B2B relationship. Is the institute which allocates money to streamline these processes, and is there where we are present, basically.
Got it. And in terms of the stage of growth for the ones who are listening, where are you now? I know that you have raised a Series A. You already have some revenue in terms of headcount. Just give us an idea about where you are in terms of the stage of growth of the company at the moment.
Yeah, sure. I mean, we started the commercial activity already 1.5 years ago, after the certification of the product. And now we are solid present in our home market in Switzerland, but also in Norway. And we are now expanding in those which are the European sweet spots for digital activities in breast imaging. So we are present in the Nordics, in the Netherlands, in Germany, and in Italy. And in terms of evolution of the company, a lot is going on. Of course, the finalization of the Series A funding allowed us to bring the company to the next level. At the beginning, the company was very much a product development company, which were making some efforts in improving the marketability of this innovative idea. And now the company is becoming a business activities, which is setting processes that allows us to scale fast, because it's amazing how fast it can get once you get a certain visibility. And of course, you need to work on those processes which were not a priority in the time point in which you were developing the products, so customer support, marketing,
Right.
all these aspects which were before less relevant.
That's a great point. This evolution from idea to product, and then from product to business. And yes, if we start to having too many seats too early, it becomes impossible, even from a resource perspective. But when the company starts to grow, if we are also not focused on having a good balance between product and go-to-market and technology, things will not fly, right? So it's always a difficult balance, especially when we have very limited resources in the initial stages of building a company. Is not an easy job to decide who to hire next, right?
Absolutely. And even if you have, I have to say, even if you have formally an extremely precise description of the role you're looking for, then there is always the personality factor which comes together with the person. So you get this person that has some technical specification, let's call it this way, as we are in software area. But then there is the human factor, and once you're setting this new team, in my opinion, is necessary to stop a little bit and to see, okay, where are now our gaps? Do we cover everything? And really segment this growing of the company in a certain way. And I have to say, we have been super lucky now in getting 2 of the strategic figures filled with people which are really brilliant, and now they can help me and the other co-founders to really structure the operations in a further way. It would have been impossible for us to hire 25 new person in one time. The company would have collapsed, and you need to segment this hiring plan in a good way.
What is the size of the team today, Cristina?
Now we are nearly 20 person, and not everyone is working full-time, so we have less full-time equivalent, but still managing 20 personalities and individuals is a nice challenge, I have to say.
Amazing, and especially given your background before, it has been quite a transformational for you to come more from an individual contributor role, an expert role, to leading teams and leading a company and leading a business, right? And a startup that is now becoming a scale-up.
Yeah, absolutely. I'm learning together with the people. I have to say that there is something positive I took out of my academic background. Not only the technical knowledge, because now anyway I'm too far from the development front that I could be a developer, but still I keep this proximity to the product. But I think what was a big advantage of the academic background is the fact that you learn to start from zero. So you have an unknown task, and you need to organize your work to get this task accomplished. And this was for sure a big advantage.
Amazing. And walk us through a little bit the journey with the company, right? So we kind of covered b-rayZ, we covered a little bit your background and how did you come to found b-rayZ. So the company starts in December of 2019, so almost 2020, right? Almost in the beginning of the pandemic. Let's forget those moments. And it has been almost 3 years and some months. So in the beginning, what has been the kind of the evolution? So did you focus more on how did the idea come to you? Was it a passion of you? Was it an opportunity, a pool of ideas that you had in the institute? How has been
That's a
the
good
journey so
question.
far until now? Yeah.
That's a really good question. I mean, on one side, there was the long experience in the clinical front, in which we saw, okay, there is this big amount of compelling needs which are not answered by the products on the market, and then on the other side, having on your hand a big potential technology where you think, oh, shall I dare it or shall I not dare it to go for that? And then it came along the opportunity. So we started to considering solving this, which was a compelling need at the University Hospital of Zurich, and developing a product around this need. And then we went out, and this was the time in which I mean, for us, the pandemic was also a time in which we used a lot this time to challenge our assumptions on the product, to go out to do pilot studies. So in spite of the critical time of the pandemic, it was also a time where we didn't stay inactive. So fortunately, we could use in a good way this time. And then getting out and actually talking with other institutions, we found out, oh, what is not only the problem of the University Hospital of Zurich, but seems to be really a problem missing. And there we started to dive into the topic more and more, and then explore the potential. So it's not a point solution what we develop, but it's really a business idea that can scale. Is a digital space, and when you start really diving into the problem, then you start scaling your activity. I always say we scale longitudinally, so we don't do a little bit of breast imaging and then a little bit of prostate cancer, a little bit of this, because there is so much that we can deliver within our line of specialties. And this is what we are doing in terms of product. So in terms of product, there is really a huge potential in breast imaging. It is one of the highest regulated area in radiology. So breast imaging is extremely regulated. There is a lot of quality assurance, a lot of reporting, a lot of auditing. There are several accreditations, authorities that need to give certifications to the breast cancer units, and this creates opportunities, of course, for digital solutions. If you stuck to a superficial analysis of the needs of your customer, then you are also limited in the value that you are delivering. And if you start diving, then you learn that there is a lot that you can deliver. And at the moment, the journey in the terms of the product is still moving in breast diagnostics, which is a part of the journey of the patient.
Sure. No, go ahead.
No, I just, I mean, in terms of product, this was the evolution in terms of team and business. Well, first of all, we had the lucky situation in which we started already as a tight group of co-founders. But of course, we knew there were competencies and skills we were missing. So at the beginning, every one of us was a bit overtaking multiple roles, and which was necessary. And now, in terms of team structure, we are moving from a company where everyone was doing everything, let's say in a simple way, in a company in which you are creating area of specialties. And that's great to see how people grow within this situation.
Because you have the technical composition of a startup founding team, so you have the CEO or the business background and the CTO. the technical background, and of course for healthtech you also have the medical advisor. The medical advisor is also a co-founder of the company, right?
Yes, correct. And
And the
we are going.
medical advisor is full-time as the other founders, because sometimes I see in healthtech companies that there is this challenge that sometimes the doctor has his own practice or his own clinic or her own clinic and might not be able to be full-time with the
That's
venture,
correct.
right?
Yeah, also in our case, it's not full-time committed to the company. It's always difficult if you want to have a good advice. You need to take a key opinion leader, and the key opinion leader cannot commit completely to a
Right.
business. He needs to be close to the clinical front. That's correct,
Right.
but we also recognize that, and it's also important to understand that the view of one key opinion leader is also influenced from the setting that this person knows, and medicine depends very much on different factors. There are cultural factors, there are economic factors. So ideally you should have a network of medical advisors.
Right.
And this is what we are trying to do now with our advisory board, where we have radiologists from different countries, and we have also people coming from the industry or representative of patients. That allows us to have a brighter view on what are the needs outside the DACH region, where there is a certain similarity in the culture, in the healthiness of the health system, and so on.
Right. So the advisory board is not only a medical advisory board; it's really a full advisory board covering different functions, different geographies, different stakeholders. Let's say to advise. And is you who leads the advisory board? I assume, right?
No, I'm in close contact with the advisory board, but the lead of the advisory board is by Professor Andreas Boss, which is the co-founder of b-rayZ, because we thought that
and the medical advisor, right?
Yes, and the medical advisor.
Okay,
exactly.
got it. Got it. No, I was just highlighting this point because it might be very useful for other entrepreneurs out there that are thinking about starting their own health tech companies. Typically in a poor SaaS, non-health tech, it is typically the advice: start with someone from business background and a very strong product and technical person on the other side. Unless the CEO also understands product, then it's much more a technical person that is able to ship the product and to work together with the CEO to develop the product. But then on these ventures, there is this extra complexity that we need to have someone who really understands healthcare and especially the area that we are working on, right? So in that sense, having that medical advisor is very important. Sometimes it comes the discussion, should be the medical just a medical advisor or also a co-founder? And if it is just an advisor, maybe the percentage would be like in any advisor, 0.5 to 2% of the company. If it is more than a normal, and we know that a lot of advisors are also not paid on equity, and they love to contribute, but usually when we have such a very close advisor to the company, but when it's a co-founder, a medical advisor, sometimes it takes a little bit an extra chunk of equity of the company. That's why I was asking, because I know that this is a very common question for any founder that is trying to put together what is the free layer or the free legs of the founding team. And we are seeing more and more founding teams, especially in health tech, with free legs, because we need to have, again, the business background, the technical background, and the medical background to be able to have an initial founding team. And then, of course, the team needs to keep growing, as you said, going from generalists to more specialists as the company scales. But in the beginning, we need to be able to make things get out of the ground just with those free people, right?
Yeah, absolutely. It's a big challenge. So you need people which are committed to the idea. Yeah. I fully agree. And Yeah, also I think the selection also of the people that come into the advisory board is really something you should do carefully, because there are a lot of generous people out there that want to support the startup, and of course, you as a startup, generally you cannot pay a fortune for an advisory
Right.
role, so you need really to find someone which believes in your idea, that commits to give you this help. It may be in terms of hours, not a big commitment, but it may be this strategic connection or these strategic
Right.
inputs that they give you, which is enormously valuable. But I would really recommend to have a diverse board, or a diverse network, even if you don't formalize into an advisory board, but
Right.
try to have inputs from different geographical area, but also from different perspectives, especially in medtech. I mean, digital health is something different than IT. So
Yeah.
it's you're entering with a new generation of products into a market which is an established market, from players that are there since a long time, and also the purchasing processes of the customers, for example,
Right.
are shaped based on the traditional form of the market. So, for example, sometimes we hear the suggestions. You know, you can do the pay-per-use, you can make it as customer friendly as possible, because in other industry of the IT, we are used to this pay-per-use also for the app you have on your cell phone. Yes, everything is great, but you need to confront yourself with what is established at the side of the customers. So are
Right.
the customer really free to use the budget in the way you think it should be best used? Or are there some structures which exist already? And healthcare is extremely, yeah, it's not so flexible actually as it would be the free market. There are some rules that protect this special industry, and you need to be aware of these rules. So if you don't have this knowledge, it's great to ask an advisor that has
Yeah.
this knowledge to support you there.
And you see, this is another very important question for the ones who are listening, which is, do you see more the advisory board playing on a one-on-one dynamic, or do you also see that they should meet kind of 3 times a year all together? So and it's not one or another. I believe that you need to reach out when you have questions, of course, in a one-on-one manner, but you also believe that the group component is important, or it takes, because again, the founder and CEO has so many stuff to do that also putting together those events, it's an extra amount of time and energy. And again, we know how crazy it is, the life of a founder CEO that needs to manage the company in those initial stages. So sometimes I think that some founders are afraid of advisory boards because it might take some extra effort to stay to keep everyone engaged and everyone happy. And for the advisory board members that are listening, I would say try to be kind to the founder, and to not think that the founder doesn't consider you is because the founder is trying to tackle too many fires. That sometimes there is no communication. It doesn't mean that the founder doesn't appreciate, and sometimes it also doesn't mean that the founder will only call you when there is a problem, right? but that's how it is.
That's a good question. No, actually, we try to do both, as you said, of course, to have this coming together. Nowadays, it's not always to possible to do it physically, that we meet regularly together, but we say, okay, at least one per year we should meet physically.
Okay.
I still think it's important because of 2 reasons. Because it's intellectually more interesting to have a conversation also for them. It's
Yeah.
logistically easier to update them all together. So we are at this stage now, and instead of doing this one-per-one reporting, and the third one is really again the one of making the commitment and the bonding to the company stronger, because they see that there are faces, and there are faces of experts, of people with an excellent profile that committed to the company, and this also reinforces their own commitment. And
Right.
I always think it's you can and I know it's a challenge, as you say, because one never has enough time, but one needs to create these opportunities of creativity. And you are not creative if you only do a Zoom meeting and you
Right.
focus and discuss on a specific task. The creativity is fostered when you create these coming together events. And I think it's worth spending the time and the resources to do it.
And a lot of times that creativity comes not in the agenda points of the event, but outside in the lunch or in the dinner or in the coffee or the tea, whatever it is. That's when those ideas come and people get excited and find new avenues of growth.
Absolutely. We had one of our best idea. We had driving back all together from a business meeting. We were in the car 6 hours, and then it was really a creative moment. But sometimes really it was funny because we had in the car, we have the medical advisor, me, and the developers. So it was a constellation that you rarely put together. Because you have the management meeting, then you have the developers meeting, but you need really to mix people, to put people together and shake it, and then you can harvest.
Yeah, just to close kind of this chapter of the team, so the evolution of the team was clear, right? So you started more with technical people, both product and tech and medical, to help you out, and then you start now opening for more go-to-market positions with marketing and sales to start moving the company from a product to a business, as we were discussing before, correct?
Exactly.
Cool. Let's go into European expansion. You already pointed some of the regions where you are at the moment. You said Switzerland, the Nordics, and you started with Switzerland and Norway, then the Nordics, Germany, Italy, and the Netherlands. In the beginning, it might be quite difficult to open too many markets at the same time, and there is this importance of focus. So how are you planning your European expansion? How is it evolving with b-rayZ?
That's a good question. I think as always, you need to do your homework. So the first homework is the one of looking at the characteristic of the territory where you could go in. And some of the criteria for us in our specific area is to look if there is, for example, an established breast cancer screening program. What is the size of this breast cancer screening program? This is we have the big advantage that this kind of information are available publicly because they need to report periodically. So you know more or less what is the size of the market there. And then you need to look how mature is this market for your solution. So there are, for example, in some countries, there are some activities which have shown a certain maturity in digitalization of procedures in healthcare. So I don't know, there is in most of the countries, for example, our a kind of products or our class of products is not reimbursed by the medical insurance, but there are some countries which have started some pilot programs there. So it may make sense to take this country at the upside of the list because they may be smaller in terms of market, but allows you to get faster into a commercial agreement with the people. And then, of course, your how do you say this competitive unfair competitive advantage, or it's called if you have a network, if you have a way that allows you to reach the most important segment of customers in this region, then you should consider that. And in medical, in digital health, in B2B businesses, you cannot exclude the collaboration with key opinion leaders. So you really need experts that use your solution, that work with your solution, that present your solution in the congresses. So if you have this network more present in one region, this is also another point to make this region on the top of the list. And then there is of course the big question of the logistic of the sales processes. So how do you cover with a relatively small team large territories with a product which is still a medical device? So it's not a Microsoft license or something that you download from the internet. It's a medical device, has a certain price, as a certain
even being a software for the ones who are listening, it might be
sure
it's not an it's not a
physical
hardware,
device, exactly. Even if this a software is still a medical device, it still requires a lot of efforts and clinical studies to get ready to the market, and you are asking for good money for this solution, and people want to see a face behind this software. So, and how do you manage that? Well, there are different possibilities. You have the opportunity of setting a big sales force in human resources, and you go directly with your sales forces and you distribute the product directly. You have the possibility of selecting a network of distributors. My recommendation there is to try to find people that have are targeting the same customers you want to target, and go there and sell your product together with the other product they would present there. And then there is the possibility of networking or partnershiping with industry partners which are already present at the side of the customers. So these are opportunities which are important to take into account. What is the right solution? I can't tell you. It depends very much on where are your strengths and how is the regional market. You may also use different solutions for different markets.
Right. And in terms of expansion, do you think that the big dream or the big vision for the company would be to be the European leader, or do you also think there is space to expand to the US, being the largest healthcare market in the world?
Yeah, absolutely. I mean, the market we are addressing is a global market. North America is, of course, the largest global market. So for sure, we have a plan to expand to US, and we are already working on that. So it's a market I think is a must market for us.
Love it. So let's move into one of the hot topics that any founder likes to talk about, which is fundraising. I think that's something very special about your journey is that the Series A round. When did you raise the A rounds, Cristina?
It was last July.
last July. So was your first dilutive round? So you were able to get until Series A without having any equity rounds, so all non-dilutive rounds. So how has been this journey? How has been some of the lessons learned during this journey? I think that for the ones who are listening, I assume that, and we have discussed this before, it is an advantage, it is a pro and a con, right? So because there is also a lot of paperwork and things to do, and it gets a little bit slower, but at the same time, it is a luxury to get it at Series A with a very big chunk of the company, and allows you to go to the next rounds super comfortable, to be able to keep diluting yourself in order to raise more capital to scale the company, right?
Yeah, I mean, fundraising is always fun, as everyone knows. It's wow,
overwhelming, despair. Now the truth.
I'm looking forward to the next fundraising round. I can't wait. I think it was a bit special in our case also because we had this strong academic background, and the fact that we are a spin-off of the University Hospital of Zurich allowed us to make use of some incubation programs, which are really meant to push innovation out of the academia. So if you are fitting to the same profile as we have, do it, because it's really, as you said, Mike, is a luxury. And if you have an academic background, you're also quite you have some exercise in fundraising, because you always write grants for your research activities. So use it if you have these resources. Don't put it on the side just because everyone tells you that you need to jump or something crazy in this direction. I make use of that. What is the advantage is clear. So you have non-dilutive funds. You don't have investors to report. You have a certain freedom, and the disadvantages are different. I would say there is the disadvantage of reporting. There is the disadvantage that is not sure that you get the money, so you are a bit limited in the capability of planning. And the third big disadvantage is that generally you get these funds mostly for product development, so you cannot hire business figures on this kind of money generally. So it's very good for product development, or for doing clinical studies, or for clinical investigations. Even usability you can partially cover with this money, but then you cannot hire a director sales or marketing person. We did it by using both possibilities. Also, we added the first revenues, which allowed us to take some different profiles, or to have this cash that you need, I don't know, for marketing material, for registering for a congress, all these kind of things. You need to pay cash. You cannot pay with these grants. But I think it's also well, of course, we are in Switzerland, and Switzerland is a place to be for innovation, because there is a certain number of these
medtech and healthtech
foundations.
Super strong, right?
Yes, it's super strong. And the second point, which is also an advantage, is that these kind of foundations make a sort of triage of the startup. So it's a sort of a quality label if you made it to some foundations, and this helps you to approach the other segment of investors that you want to get at a certain time point.
Right. And how has been this? Now I'm thinking this mindset shift. So first you need to be much more, you are more comfortable because you know what you need to do on those grants and on those reports, what you need to show. And then you start talking with another kind of human beings who have a different way of thinking about investment, right? So you need to get to learn all the fundraising jargon to put together a deck with a TAM, with a problem solution, with with differentiation, with of course the team, the product vision, the product direction, the why now. I'm just thinking about the different components that we need to include in the deck. So it's a different language, and it might have been a source of immense learning for you during the process, right?
Yeah, I would love to be able to say that it was easy, but it was not. And we did mistakes. I did mistakes. I regret now, but I mean, without going through this process, we would not be where we are at the moment. So I always think, okay, even if it was a situation you would have preferred not to experience in your life, this makes you to a better person for the next possibility. So as you said, for example, at the beginning, we were, I don't know how many versions of my pitch deck I have, 2 billions probably. And if I look at the first one, I get horrible feedbacks because feelings, because it was really an academic pitch, an academic presentation. You present your aim, your materials and methods, and your potentials. And when you start talking with investors, of course, they are interested in other aspects that for you are different. So I remember I was talking with one person of Venture Geek, which is one of these big foundations in Switzerland, and he asked me something. Can you estimate? I don't know anymore. The number of breast radiologists in Europe,
Right.
and I was like, I was thinking and thinking, and they said, I hate scientists. Every time you ask a number, it's like you're drawing their blood. And it was really like that. I mean, at the beginning, I mean, it's not important to be precise.
Wow.
The second digit after the comma, you need to give an order of magnitude which is reasonable. And
now I understand what you meant. Okay, got it. Just give us a number, more or less. It doesn't
yeah,
need
that
to be
makes
super
sense.
precise.
And you need to kill the scientists in you, basically.
Got it. That's amazing. What has been the size of the round? I know that this is public, so you can disclose, right?
Yes, we had over 4 million.
Okay, well done. Cool. And the time is flying, and I still wanted to go through more a deep dive of how has been your evolution of the career and transition, but I think that we will let that for another episode, and I'm sure that the next chapters will be exciting as well. So there's a good excuse for having you back on the show a little bit later on the b-rayZ journey. So let's go into the last segment of the show, where I ask you a quick question, and you give me a brief answer, and we go step by step. So let's start with the 3 self-reflective questions. The first one: if you would have the opportunity to have a coffee or a tea with Cristina at the end of 2019, what advice would you offer to your younger self?
Okay. Oh, that's good. Okay, once I read a sentence, I don't know from whom it was, and it said something like, business opportunities are like buses. There is always the next one to come. So I would tell to Cristina of that time, there is no reason to spend a sleepless night. There is always a day after the night, and one needs to be aware that there is a lot of work related to the success of a startup. There is a lot that you can control, and you should learn, and you should do it. But there is also a component which is related to just luck, or not luck, or bad luck. And this is a part of the job that you need to accept, is a part of the game.
Love it. What are you the most proud of on your journey so far?
Professionally, for b-rayZ?
Yeah, for b-rayZ, yes.
I'm super happy about the team and the network we have. We have really fantastic network of people, a team of people. Of course, the product, which is innovative in many aspects. But I think for me personally, the part that gives me a lot of satisfaction is to see in the eyes of the people that work with us that they like what they are doing. It's really amazing. I love it.
Great. And worst advice ever received?
Many.
Tell me just a number.
I don't know. I delete it when I think it's a nonsense.
Exactly. You don't remember anymore. That's a good point. And now the resources, your favorite book, business or non-business. This is much more about getting to know you. Yeah.
Oh, there's so many good books.
Yeah,
I just read in the last good I read is again 1984. It's not a feel good book, but I from time to time I always take it back and read it. I read a lot, I have to say, but this is one of the.
What is the book about for the ones who are listening to be curious to go?
Yes, it's the book where the concept of the Big Brother is presented for the first time.
Okay.
So it's called. I think the original title that the author that Orwell considered was the Last Man. So basically, it tells the story of this person in a dictatorship that thinks is in its own and challenges the structures of this dictatorship. It's really worth reading that.
Awesome. Favorite movie or series, as you wish?
The last time I had a weekend watching Wednesday with my daughter. I really enjoyed it.
That's cool. And we need to have fun. And favorite podcast, excluding this one?
It's only yours.
You only have time for hours, right?
I listen, but a lot of reading books when we travel, for example, with the car. And there was one horror reading book that it was really cool, and it's called 1983 this time, not to be confused with the 84 of the book.
I will say that the numbers thing, I was targeting the number. Cristina, I was not being strict about that the books need to be numbers. Yeah. That's awesome. That's awesome. Cristina, it has been a pleasure to have you on the show. Congrats for what you have been doing so far, and best of luck for the next chapters. And you are always welcome to come back to the show.
Thank you, Mike, and congratulations to your job. And I'm super happy and honored about this invitation. Thank you so much.
Thank you, and to our community, thanks for being there. We keep here helping you as you scale your business. See you soon, and keep scaling.